Welcome to our 5 on 5. Pleased to be joined today by Pat Allen, the Director of the Oregon Health Authority. Good to see you, sir. Thanks for coming in.
Good to be here.
Pleasure to meet you. So what are you doing here in Southern Oregon?
Here for a couple of events. Rogue Community Health had a big fundraising lunch today. I was honored to be able to speak at, and while I'm here meeting with other community health leaders and just getting to know some folks.
Well, we appreciate you taking the time. I know, obviously, as you mentioned, 4,000 employees, you got a lot going on. So the Oregon Court of Appeals recently overturned a couple bans on vaping. Where do we stand right now with what the OHA is doing?
Right now, we're really focusing on consumer education and awareness. We want Oregonians to know that there is no safe level of vaping, and particularly while we really don't know what's going on, we just want people to not vape. We've had vaping illnesses and deaths around the country that are related to both marijuana and nicotine, and so we really can't pin it down to the point that we can give people guidance that there's a particular thing that's good or bad to do, and so we just really want people to stop.
Sure. Okay. And you guys are looking into legislation, perhaps? I know that's been floated by both the governor's office and the OHA.
Yeah, there's been some talk about legislation in the session in February.
Okay. 23-year-old Seattle man, I know I was briefing on this before, died last week after vaping in Klamath Falls. It may be Oregon's third vaping-related fatality. How long will it take before we know whether vaping would play a role in his death?
Depends a little bit on the complexity of the case, and as you observed, I don't really know much about this particular one yet, so it could be from days to short weeks, depending on what kinds of tests and reports need to be done.
And vaping, of course, hasn't been around very long. People haven't been consuming it for decades or anything. Do we know what long-term effects this could have on our bodies?
That's one of the things that really is the biggest cause for concern. While vaping nicotine has been around for some time, vaping marijuana legally is relatively new, as you say, and we just really don't know enough to be able to give people good guidance.
Okay. 1 in 3 Jackson County residents are on the Oregon Health Plan. Are there any major changes coming to it in 2020?
Yeah, Jackson County has 2 great coordinated care organizations, which are the organizations that we use to deliver the Oregon Health Plan, All Care and Jackson Care Connect. We're going to ask them to redouble the good work that they already do in 4 areas. We want them to improve the way they deliver mental health and substance use treatment and support. We want them to focus on paying not so much for the volume of services that get delivered, but for the value, for the improvements to health care. We want them to really focus on what we call social determinants of health. It's the things that aren't really directly health care, but have an impact on how healthy you are, like your housing, your access to good, healthy food, those kinds of things. And then finally, we want them to continue to focus, as they have been, on managing costs.
Okay, we're going to take a quick commercial break. Much more in just a moment. Stay with us. Welcome back to our 5 on 5. Again, here with Pat Allen, the Director of the Oregon Health Authority. What is your biggest focus as you approach 2020?
I think right now the entire healthcare and really public policy system has done a big focus on kids. Really thinking about kids from before their mother's even pregnant, certainly to about age 3 or age 4. We realize today more and more that investments in kids' health and well-being at that very early age, it pays benefits for decades after the fact. And so whether it's investments that we're making in universally available home visiting for newborn children, to suicide prevention in schools, mental health professional resources for schools, to the Student Success Act, which is a big education funding bill, but it's also a really big healthcare bill with investments in mental health for kids, really focusing on young children and their families and how we can be more supportive and help them get off to a good start is a huge focus for us this year.
The housing crisis is of course, huge from Portland to Southern Oregon. How is the issue of mental illness, what is the Oregon Health Authority doing to address these problems?
Yeah, so great question. The mental illness and housing go hand in hand with each other. Upwards of 60% of people who are homeless today suffer from a mental illness or a substance use disorder or both. And so what we're trying to do is make more investments in providing housing to get people off the streets so that we can then get them access to services. The legislature passed about $20 million in what we call supportive housing investments. That's housing with services together to help people get off the streets and then be able to receive the services they need. We're also sending resources to local communities to help when someone is arrested but has a mental illness that keeps them from participating in their trial, to have resources locally to keep that person in their community, get them restored to competence so they can then go through the criminal process if that's necessary.
Okay, great to see you. Thank you for taking the time. Appreciate it.
Thank you.
All right, stay with us. We'll be right back.